Howdy, y'all. Trace Johannesson here, coming at you live from Back Porch Sundays. A couple of updates for you. Listen, kind of in recent local news here in Rockwall, we had an emergency city council meeting to discuss how we were going to handle the 4th of July festivities, the outdoor parade, and some fireworks, especially in light of the COVID crisis. And given that several of our neighboring counties have canceled their activities, many of you don't know this, but for the last 4 months, I have been on the Rockwall County COVID Task Force. I spend a few hours a week, and I check the data just about every day. So this is the spread in the hospital capacity in the region is something that I've been tracking for quite a while. Trying to learn as much about it as I can, and trying to balance the role between, caring the public health and then the limited government involvement. What we discovered, obviously, was when we went into lockdown, we erred way too far on the side of government overreach. So now we have to kind of come back to a little more, something a little more balanced, okay? So we have allowed some reopening in the state, here in Rockwall as well, and we have seen some cases go up. Now, if you're to believe the media, which benefits from clicks as currency, as I call it, the sky is falling. And it's great to make headlines about that, and it's great to make money off of people's panic and to profit on panic. It's not very useful, however. I'd like to have a calm, rational discussion about data. So we voted, and I voted strongly to allow the outdoor activities in Rockwall. Why? Because CDC and many other scientific studies demonstrate consistently that the best way, the most common way to contract the virus is indoors in confined spaces for prolonged periods of time. Okay? By allowing that parade and activities outside to go on, the spread of the disease outside is extremely low probability. Okay? I get a lot of comments that you don't care about people. And I get that. You might seem that. But let's dig into that statement a little bit. That assumes, because I decided not to make a law preventing people from gathering outside voluntarily, that automatically means I don't care about people. I think this is a fundamental disagreement on the role of government. But at the same time, because I've been digging into this data for quite a while, and I've got a pretty strong opinions that they're malleable, right? I look at the data and I make decisions, and if I have to change my mind, I do. But it's brought to my attention that when I am confident in a decision, my lovely wife brought it to my attention that I can come off as arrogant. And that's fair. She gives me the tough love, true friends stab you in the front, as they say. And I've heard that from other sources as well, especially in light of the way I treated the city council meeting. That was not my intent. And so when my perception doesn't match my intent, I want to dig into that a little bit. So, hey, Stephen Covey, seek first to understand, then to be understood. I, looking in the rearview mirror, I probably could have done a better job of listening to folks and hearing their concerns. I probably went back to explaining our rationale because I don't find it useful to make decisions based on anecdotal evidence or stories. That's the kind of stuff that makes headlines. I find it useful to make decisions based on data, and specifically data that does not profit from clicks. So not media like Texas DSHS, like Dallas Health and Human Services. These are sources I look at consistently because they don't profit from hype. They profit from the data. So, hey, Tiffany, how's it going? One of my favorite liberals from college. I wanted to also articulate a little bit behind my decision and my thinking on the council decisions. So I actually wrote an article about it. And if you're interested in long form discussion about the subject, please take a look. If you're interested in doing a drive-by angry Facebook posting, that's totally your right. If you want to call me names, which I have been called, that's fine too. Just, as a polite Southern Texan, don't expect a lot out of me if you start with an insult, especially if you send an anonymous email and y'all know who you are. But let's get back to what exactly is the role of government. One of the concepts that came up was the subject of masks. A lot of folks have told me that we should make those mandatory. I believe in limited government because I know from experience serving in the Marine Corps and working for federal clients in my consulting world that the government entities in general are typically terrible allocators of resources. They're not very effective at getting things done. So I believe in limited government as a practice, and we practice that here in Rockwall, and I intend to take that to Washington. So when I try to determine, as a good consultant who makes his decisions based on facts and data, I attempt to figure out what is the greatest causality for the spread. Well, the CDC and the WHO and most all studies agree, again, the highest probability of contracting the virus is prolonged periods in confined spaces with an infected patient for indoors for a long time. There is very low likelihood that we contract this virus by passing somebody in the grocery aisle or by standing outside for a few minutes or just by walking past another person. It's very low likelihood. So given that data and that science and my limited government propensity and the fact that our hospitals are not close to capacity, despite what the media headlines might say. In the region, we have a bunch of capacity and there is surge capacity. And we watch those numbers. I don't see any reason to mandate mask wearing. There needs to be a good reason to create, in my opinion, there should be a very, very good reason to create a law. That being said, I'm not a medical professional. My job as a legislator is to balance public health and create legislation that aligns with what our taxpayers and the tax base needs from us. We don't need to take our cues from other counties from the state. We know how to manage our county best. Look, Texas is a huge state. We have a diverse population, both in density and demographic, and nobody knows how to govern best but small governments. As I mentioned, outdoor spread is extremely rare, and that's from the New England Journal of Medicine. But look, the CDC and the New England Journal of Medicine all agree that wearing masks can stop the spread. Am I saying it doesn't? No, absolutely not. It definitely can. In fact, my family, we wear masks per CDC guidelines when we can't avoid or we can't maintain social distancing. So if we have to be in a confined space with an unknown party for a prolonged period of time, we'll wear masks. When it's required, we'll wear it. I'm just saying that because my thought process in the role of government, making them mandated is not justified. Here's the quote from the New England Journal of Medicine. Extremely minimal. With that being said, that's probably enough of the soapbox. I did want to just explain my thinking on the recent Rockwall decision we made. And like I said, our county knows how to govern itself best. Dallas County may have its own set of problems they're dealing with. I don't know, but we're handling our stuff, and I wrote quite a lot about it. All right, that's enough about the Rockwall 4th of July activities, which will be going on this week in the campaign. We're coming up. We've got going to visit Rains County and Upshur County are on the radar, and lots of phone calls and meetings with those folks. Other than that, that's all I've got. I went a little bit longer because I wanted to kind of talk about my thinking and explain my rationale. Again, my intent is not to be confrontational or arrogant. I've been in the data for 4 months, and I've been looking at this for a long time, and I track it almost every day. And so I have strong opinions that are well formed, and I don't intend to come off as arrogant. It's not my cup of tea. Well, actually, before I go, my friend Tiffany brought up a question. What do you think of state officials banning counties and cities from implementing local measures? This is a very broad question. In general, as a philosophy, I'm not a big fan of government making law. I'm not a big fan of big government. So while it's interesting that we at the state level reject the U.S. government for trying to tell us what to do. Sometimes at the state level, they pass laws down to the local level that we disagree with. I know that the governor, and oh, by the way, this is a lot of Monday morning quarterbacking, I'll be honest. I'm very critical of a lot of FDR, Franklin Delano Roosevelt's policy choices. But at the same time, I recognize the context, right? I'm looking at it with Trace's lens through today. I was not sitting in his chair back when the Great Depression was on, knowing that he had to do something, and doing nothing was not an option. Likewise, Governor Abbott is in a very difficult position, and I don't want to Monday morning quarterback everything he does. With that being said, if I were in his shoes, I would try and push most things down to the county levels and figure out what they need. Like Harris County, where you're having some problems, what does that look like? What do you need from the state? And I would try to mostly put that into the county's hands. That's really all I've got to say about that. That's my general philosophy. Look, the counties typically tend to know what's best for them. And Governor Abbott's previous guidelines about reopening, and their guidelines, by the way, not laws, were structured in a great way. Let's say that I'm a county that doesn't have the resources to have a health authority and doesn't know how to tackle this problem. Well, now I've got some guidelines to look at. That's a great use of the state government, and that's a great use of Abbott's plan or his guidelines for reopening. Some counties, like Dallas and Harris County, have a lot of resources and a large health authority. We in Rockwall County don't have a health authority. In fact, that's one thing that may change out of this. What we've learned, why that's a problem, is we have learned that recently our numbers for COVID cases weren't reported for several days because we got our numbers from the state. And then there looked like a huge spike. And that was because the state did some kind of system upgrade and there's a delay in reporting. If we had a county health authority, and we're entertaining that going forward to see how that makes sense in Rockwall County, that would allow us for any future discussions to have the actual authority and the funding to create our own data that we can look at near real time so we can make real-time decisions. Does that mean we're only going to look here at the county? Absolutely not. We look at what's happening next door in Dallas County. We look at what's happening in the region, because all of these things are important. We can't have a myopic focus. I mean, most of us drive across county lines when we work, but having a county health authority in the future will enable us to avoid this data inconsistently and be able to make better decisions and communicate with our citizens what's going on. Anyway, just that was a longer update than I'm used to, but I thought it was important to have that conversation and get that out there. But as always, tracefortexas.com, and everyone have a wonderful week, and we'll talk soon.